bags, hand them into individuals. We call it like a burn when we use UVC light. So we burn these masks 3 times, and then would discard them after that, just to increase the longevity of this mask. And it was, stuff that the CDC recommended. WOW recommended it. I mean, we followed the proper protocols, and we've prevented it, or increased the longevity of these PPEs. So we use this UVC light. We use a machine called the Trudy machine to kind of like, it looks like a big light bulb basically, and we use that to disinfect it. So UVC light, what it does, it unbinds the DNA code of any bacteria and unbinds it to nothing. So this is the practice that we use.
Very interesting. Jeff?
Yeah, that's a fantastic means of prepping PPE. Rusty, how did you? It sounded like at one point you were really challenged staff-wise, and I know, Dion, we faced that challenge at our facility. I know Dion did, Liz did. How were you able to find the bandwidth to? Because it sounds like they entrusted that activity to EVS in order to process all the PPE. Were you just doing it for your staff members to make sure that they were clear, or you were handling the disinfection of masks for staff all over your facility?
It was all hands on. Myself, a group of my managers worked 16-hour shifts, 7 days a week, to man this station, so that the housekeepers can get to do their job. Our management team stepped up to the plate, and I lived at the hospital. I slept in a hotel across the street from the hospital, and 2-3 hours of sleep to come back and get this done. They entrusted us. Our infection control team was on board with the recommendations and regulations, and we managed so that a team that can clean. They are the experts. I've been doing this a long time, but these guys are the doctors of our job. They're the professionals. They have a doctorate in cleaning, and we entrusted them in doing that. We're a huge hospital, 800-bed hospital, but when COVID hit, half of the patients in the hospital were COVID patients, and we lost. It was like 400 patients for COVID. We had 500 patients out of the 800. So, it was so bad. So one good thing about it is that we didn't have the scope, the area to cover. So we used what we had to kind of like spread them out to help out, remove trash, disinfect the horizontal surfaces, and make sure things were clean. Things were minimal, so that helped us a little bit. So we can reman our resources.
That sounds great. Were you also utilizing the UV technology in disinfecting patient rooms as well?
Yes, sir. So we've been doing this practice for over 4 years. We've been using UVC light to disinfect HEDIF rooms in particular, drop our rate, HAI rate, which is dramatic. Our HAI rate dropped more than 30% by using UVC light, in addition to cleaning. So we clean the room, then Trudy the room, or UVC the room, and then make it available for the patient. This is technology that we've been using, and it's been working in terms of HEDIF, which was it's a monster debilitating disease as well, as you guys know. We'd use that now.
No, that's fantastic. And if you listen to some of the earlier podcasts, we were talking about alternative methods of cleaning and disinfecting because
yes, sir.
It's 2020. We have to think outside the box for a lot of things. I think we all can agree that there's a lot of things that we're going to do that are still going to be the same, and that were the same as they were 30, 40 years ago. Like, you can't clean a room without wiping surfaces, clean a room without mopping the floor. But when you can incorporate additional technologies, whether it's a fogging system, UV lights, hypochlorous acid, something,
yes,
high-grade microdenier to pick up germs and biofilm off of surfaces, you've got to really think outside the box, and that's a great way of protecting your patients and keeping your environment clean. Great job.
Okay. And as we always mention, it has to be in addition to, because nothing is better than elbow grease. You have to put in the mechanical motion and the mechanical action to remove that biofilm.
Yeah, I agree. I agree with Dion tremendously. You have to, wipe, not swipe. The old model. You have to be able to agitate the surface first, and then get this additional disinfecting model up. It's important to, like Dion said, make sure you get in there and use, elbow grease, and then, with the disinfectant, and then use these alternative methods.
Rusty, your team seems like it's been through so much, and your leadership right now is just really showing through. So, question for you, and for any other EVS leader that is going to be listening now to our podcast: how are you helping your team, or how have you helped them to renew spaces, restock supplies, and recharge? So, talk to us about your renew, restock, and recharge.
Yeah, so for us, first and foremost, we have to renew, recharge, restock our mental status. We have to be able to, now that we have this open forum for, wearing a mask and 6 feet apart, is to kind of celebrate also what we've done. Our institution did a Heroes Plus Week, kind of say, hey guys, thank you for the stuff you've done, reinvigorate them and say, hey, listen, we appreciate you, we thank you for what you're doing. Bring us together as a family and say, you guys are all heroes. People get motivated by that kind of stuff, And now that we're decanting units from COVID to non-COVID, people feel like we've won the war on, on this disease. That in itself, that motivation was to say, hey, we've dropped down so much. It's increased the capacity of what these individuals do on a daily basis. It's a saying thank you goes a long way, showing them that there's alternative means of saying thank you, giving them T-shirts, getting them food, the old-fashioned pat on the back, and we had the bonus pay that everybody got, and then our hospital ended up saying, hey, you know what, thank you for what you're doing, we're going to give you guys hero pay. All those little things helped renew and revigorate our staff to say, hey, this can't beat us. We have to move forward and step up, and we are the true heroes. And that in itself was motivation to get these people, the 60% of the people who stayed, to say, hey, let's get it moving. And that helped us. Now the people see that that this disease couldn't beat us. We're getting more people to come back. This is important. Come back. Let's go back to a sense of normalcy. And unfortunately, COVID is normalcy for us because we still have patients. We're always going to have these COVID patients. But now there's a sense of like a sense of security, a security blanket to say, listen, our disinfectant works, our PPE works. We're being looked at as heroes no matter what our occupation is. And that is in itself something of a huge movement that a lot of institutions are doing, which is I'm happy of.
So my question is, since you lost 40% of your staffing,
mm-hmm.
I know COVID reduced our hospital's capacity a great deal, yes, and sir. We lost funding because of it. No surgeries, no same-day surgeries, no major surgeries. Did you guys lose staffing because of it, or you're able to ramp back up that 40%?
Oh man, that's a really good question, Dion. We from the 40%, we've probably got 15% back. People are trusting in what the nation is doing, and people are wanting to get back to it. People are saying, we're safe now. Let's get back to the work that we can do. So slowly but surely, we're not there yet. We have about 178 FTEs in out of the 229 now. So we're getting there slowly but surely. People are wanting to come back to the hospital. Sick people now are coming back to the hospital. Operations started. I mean, we used to have about 150 cases in our OR, and believe it or not, now we have 70 cases, which is good because COVID we had 5, we had 0, we had 20. And this is the moneymaker for the hospitals to operate on.
Right. So Joseph, what about your facility?
I think what I can take from this is that communication is key here, because I work with the doctors and the nurses and EVS, and I know that when I'm doing an exam and it's a patient that's infected, and I do sometimes see housekeepers trying to get into the room. They're trying to clean, and I would talk to them. I would say, "Hey, I understand that you're to reduce the infection, the exposure." I would tell them, "Hold on one second. I'll actually get this garbage for you. Just give me 1 second, and I'll tie up the bag, and I'll give them to them while they're waiting outside, just so they don't get exposed. Because I know when it comes to uh, getting the PPE, it's really hard, especially with such a scarcity with like N95s and masks, and you would have to throw them out after a certain time. And I understand what they have to go through. It's not just one room; they have to go through an entire unit. So I like to do my part and help out with them and communicate with like the linen, the garbage. Something small, it's a small gesture. Um, Actually, I want to touch about the UVC technology. I've actually used UVC before, back when I was a housekeeper, and it's extremely effective. I understand when you set the popcorn smell. I've experienced that a few times. Yeah, it's hilarious. But to use it on the mask, I think that's genius. Because I was trained to use it for patients' rooms to get rid of C. diff.
Hmm.
And to hear that you can use it on mask or goggles, maybe some gloves, I think that's innovation right there.
Great.
It's good
That's
planning.
definitely thinking outside the box. So I wanted to ask because first off, I want to thank you because your perspective from being a housekeeper and now you're in a clinical role. I want to say how much I appreciate that, and I kind of wish that we would have more clinical professionals who could really see it from the aspect of EVS. You mentioning about taking the time to bag up a bag of trash or a bag of linen so the housekeeper doesn't have to go in there. At my facility, we had a number of folks who did that and were great partners. And we also knew there were some individuals that they were very busy and they couldn't afford to step away to do that. Those are the little things that really go a long way in showing that the EVS team, the support services team, housekeeping, that they're really appreciated. So I wanted to mention that first, but I did have a question. So now that we're kind of entering a new normalcy with regards to COVID, you notice with your coworkers, or whether it's in the clinical field, non-clinical field, do you notice people changing habits, like things
Oh,
that they used to either take for granted or that they were prone to do, and now they're a little bit more aware of, and they're changing their behaviors because of just how rampant this was.
yes. We now have a new cleaning product. It's with Clorox, and it's like the healthcare grade where we're now cleaning our computers. We're dusting. We have new machines that we clean properly. We have new protective gear for the probes that we use, so we don't cross-contaminate between patients. It's almost as if we're in housekeeping now, because we're cleaning our beds, we're cleaning everything. We're changing out pillows. I even give them a few pointers as to how to get between the crevices, because those are spots that you can miss when cleaning. It's not just swiping across the table and it's clean. No, you actually have to apply some elbow grease. I know recently we now have this new schedule where we rotate, because there's about 25, 30 people in our department. Like maybe 5 per week would be the designated person to clean our racks where we hold our trophon rooms that cleans the transvaginal probes or other equipment. And the following week or the following month, we'll have a new set of people to take turns to clean. So we're now entering a new protocol in terms of remaining, how you say, clean and sanitized.
That's excellent, Joe. That's very excellent, Joseph. It's nice to hear that we have moved into this era, and people are paying so much more attention to cleaning. I rounded today and I overheard some nurses and nurse managers ensuring that they pick up their gloves off the floor or pick up their loose debris from the room upon exiting the room because they don't want to leave anything behind.